Welcome back. And this is the last in the series where we're going to be talking about nervous tissue. And this one specifically, we're talking about the process of neurotransmission, what's going to happen going from one neuron to the next cell. And so for that, we have to use that term action potential. This is when an electrical potential is going to occur. It develops after the neuron's plasma membrane was stimulated, it's reached its threshold. And if it's traveling along an axon, we can also call it a nerve impulse. So here is what happens. It travels all the way down. We already learned about this. We had the resting axon that was negative on the inside. We had sodium gates opening, depolarization, potassium gates opening, repolarization, sodium potassium pump, and that all the way traveled down to the axon terminal. In the axon terminal, we have preformed vesicles, these yellow circles filled with neurotransmitters, these little brown dots. Okay. Now the red squiggly line, this is the action potential reaching the axon terminal. When the action potential reaches the axon terminal, it causes something different to happen in the axon terminal. And that is, there is a gate that the voltage is going to cause to open, and calcium ions are going to enter the axon terminal. And when we have calcium inside the axon terminal, that is going to stimulate these vesicles to move down towards the plasma membrane and bind to a protein here on the plasma membrane to fuse with it. And so they can undergo exocytosis and release their neurotransmitters into the synaptic cleft. So calcium is coming into play now for the first time. And notice this is not calcium that was stored in the cell. This was extracellular calcium that had to come in through a gate that was open because of the nerve impulse. Okay, so now we have neurotransmitters in the synaptic cleft, and it's looking for its receptor on the postsynaptic cell, whether it's another neuron or it's an effector cell. And when it finds its receptor, it's going to bind to its receptor, and that opens a channel, and ions will usually enter the cell if it's going to be excitatory. Okay, if sodium is entering the postsynaptic cell, it can trigger a new action potential in that postsynaptic cell. Okay, you're going to have depolarization and it would carry on down that plasma membrane. Almost immediately, that neurotransmitter gets kicked off of its binding site and that ion channel closes. Now, what happens to that neurotransmitter? Well, one of three things. If there is an enzyme sitting in that synapse, then the neurotransmitter is broken down right then and there. It cannot be reused. Some neurotransmitters are taken back up into the presynaptic cell through endocytosis, and they can be repackaged into vesicles, which can be reused if there's a nerve impulse that comes down. Other neurotransmitters can be taken back up, repackaged, and then destroyed by a lysosome that comes along and destroys it in the presynaptic neuron. Bottom line is, most neurotransmitters are going to be destroyed, but some of them can be reused. So here's a quick think about neurotransmission. Go through, make sure you understand the whole process. Don't forget about using the words action potential, about using the words receptors and the ion channels and the postsynaptic cell and the presynaptic cell. And don't be afraid to talk about the calcium channel and the word exocytosis. And that's it. And when we come back, it's a new day. So that's it for today. Thank you for all your hard work, and I will see you on another day.